and welcome to my presentation. My name is Joshua Noriega, and I'll be talking to you guys about HIV and AIDS epidemic in Ghana. So what is HIV and AIDS? Well, HIV, or human immunodeficiency virus, is a virus that interferes with the body's ability to fight infections and causes AIDS, or acquired immunodeficiency syndrome. There are two stages of HIV, HIV-1 and HIV-2. HIV-1 was discovered first since it is widespread worldwide, while HIV-2 is less pathogenic and is mostly restricted to West Africa. So how can someone get HIV? How is it transmitted? Well, it's transmitted by sexual contacts, such as unprotected vaginal or anal sex. It can also be transmitted by vertical transmission from mothers to infants through birth or milk secretions from the breast. Or it can also be transmitted by utilizing unsterile needles, syringes, or other drug injection equipment by sharing them. So from the early 1980s to today, HIV and AIDS has been lowering its incidence rates due to the benefits of antiretroviral treatments. However, certain parts of the world contribute to the overall increase in the prevalence of HIV. For example, in sub-Saharan Africa, HIV accounts for about 70% of the world's global burden of infection. This is due to because the sex work that's keeping the epidemic going, with a pooled HIV prevalence of 30.7%. Looking at West Africa, specifically Ghana, we will see prime examples of how HIV and AIDS prevalence and incidence rates have been since the infection started in the country to the present day. Now, a little background of Ghana. Ghana is a country in Western Africa, as I stated before, and is situated on the coast of the Gulf of Guinea, which is surrounded by Togo to its east, the Ivory Coast to its west, and Burkina Faso to the north. Ghana has a population of about 31.7 million people as of 2022. The first cases of HIV and AIDS in Ghana were recognized in March 1986, and by the end of that year, the numbers of AIDS cases increased to 26. Now, between 1986 and 1987, the increase was at 35%, but in 1988, the increase was 600%, with a fall of AIDS cases between 1990 and 1991. Now, how come? Well, the reason why the number of AIDS cases fell is most likely to misdiagnosis and underreporting, as the people of Ghana who were infected did not want others to know their status, particularly females. And this comes as females were estimated during this time to be 1.3 times more likely to become infected than males, even to this day. And we'll talk about it a little bit more in the further presentation about why females are more hesitant coming forward with their status. So as we can see in the chart, there are 10 regions in Ghana. These 10 regions in Ghana are the Upper West, Northern Ashanti, Upper East, Central Falata, Greater Accra, Brong Ahafo, Western and Eastern regions. So looking at the graph above, we can see that the prevalence rates in HIV in 10 regions of Ghana are different. From the Upper West, it shows that the prevalence rate of HIV was 1.7%, while in Greater Accra region is at 3.9%, and the Eastern region was the highest of prevalence rate at 6.5%. So we see that the further east we go, the higher the prevalence rates of HIV. However, regardless of these high rates that are staggered throughout the 10 regions of Ghana, show indications of severe epidemics at the time that was raging in various non-contagious parts of the country. And this could be because of the high-risk population health behaviors that were being taken. So there was a finding that was driving up the cases, and it was because the health behaviors that majority of the Ghanaians have developed. In its health survey by the Ghanaian Demographic and Health Survey from 1998 to 2003, 88% of men and 81% of women knew that condoms could be used to prevent HIV and AIDS. In addition, 80% of men knew that a healthy person could potentially be HIV and AIDS positive. So from this, it was shown that Ghanaians are aware of HIV and AIDS and how to prevent it. However, they did not feel personally affected, since many of them don't think themselves as being promiscuous with multiple partners. And this risk factor is what contributes to the increased cases, especially with the high-risk populations of female sex workers and men who have sex with men. So in 2015, there were 65,000 female sex workers and around 55,000 men who have sex with men. The prevalence rates of female sex workers during this time was 6.9 and 18.1 for men who have sex with men. In addition, looking at the graph, we can also see that the incidence rate in 2017 was 1.05%, which was resulting in 19,000 new cases of HIV and had resulted in 16,000 of AIDS that year. Doing more research, it has been found that the Ghana Demographic and Health Survey at the time did not include any data of these key populations and the amount of HIV positive that was within these populations. And this was a trend that has been set since the beginning of the epidemic in Ghana. And it has led to more people becoming affected and prevalence being high while incidence is low. This is important to know this high-risk population, since 20% of all new cases had come from female sex workers and their clients, as well as men who have sex with men. Knowing the key population, social behavior, socioeconomic status, etc., could help give accurate data and point out where the problem is and how effectively to reduce these rates. Another high-risk population that could be talked about is the female population in general, as it was being harmed. There was a study being done in the Lower Manakronos municipality, which was located in the southeastern part of the eastern region of Ghana, which is the highest region that has the high prevalence HIV rates. The study was conducted from June to July 2015 and using a qualitative analytical design. At the end of the study, it was highlighted that women living with HIV had a harder time than men living with HIV. And this is because women are being more discriminated against, stigmatized, as well as denied equal opportunities because they have the virus. And this is due to the widespread misconception that the virus is contracted by having multiple sexual partners. So they had this feeling that these women getting it are not as pure or not as clean as they say they are. So these men who have, in most of the country, has a traditional mindset. So therefore, a woman having this disease or this infection does hold much weight. It does hold much weight. So since the predominance of the epidemic in Ghana, the Ghana Demographic and Health Survey has been around and has been accumulating information on the epidemic in its earlier state. It has given a population of affected, mortality rates, incidence, prevalence rates, and demographics that were more affected, as well as the age group. The Ghana AIDS Commission has been monitoring and has been creating evaluation reports that has also been contributing to the populations being affected and giving out more accurate information. More surveillance methods has been the HIV census surveillance, the National AIDS Control Program, annual reports, and specialized surveys in specific population groups. The use of these methods has helped Ghana keep track of the epidemic and the use of the information to combat it. So these are a few prevention methods that Ghana has been using For example, we earlier found out that 88% of men and 81% of women knew that condoms could prevent HIV. However, in spite of that, they were not using it. So Ghana has came out with a media campaign around the late 1980s and early 90s. And the government started to utilize these campaigns through the press and even TV, and even in school-based programs and work programs and peer education and social marketing, to show that it was focused on abstinence, faithfulness to one partner, and also included the importance of condoms. Another one of Ghana's prevention has come from UniAIDS. As I put on here, UniAIDS has a goal which is called the 90-90-90 goal, and the description is right here on the PowerPoint, which is the goal of having 90% of people living with HIV know their status, 90% of people diagnosed with HIV receive the proper therapy, ART, and 90% of people receiving ART have viral suppression. So the Ghana AIDS Commission has took the 90-90 goal and made it to a 95-95-95 programmee. This programmee is just like the UniAIDS, however, it's just 5% increase. So far, the program has 64% of people living with HIV know there's HIV status, 96% of people diagnosed with HIV receiving ART, and 73% of people receiving ART having virus suppression. So far, Ghana has only completed the goal of having 96% of people receiving ART. However, 96% of those people that are diagnosed and receiving ART, the goal of knowing that 96% of the population is receiving treatment is great accomplishment, but the fact that do not know the infection status can mean they're not reporting. And choosing not to disclose their status or even not getting tested before getting tested is because of the fear they have of being positive. So as of 2001, research has shown that Ghana's population is comprised of more females than males, with a greater distribution of 50.7% for females and 49.3% for males. And with this, since women are 1.3 more times likely to contract HIV than males, 66% of women living with HIV, and there were 34% of men living with HIV. So the reason why people knowing their status could be lower is because most women are not trying to go through stigmatization, discrimination, or even not have the equal opportunities, or maybe not even get fired from the jobs, etc. And another prevention method that has contributed to funding was the President's Emergency Plan for Emergency Relief, which was from the United States to maximize their coverage to also acquire adequate supplies to combat the HIV and AIDS epidemic. So these barriers that I have also talked about a little bit with stigmatization, discrimination of women living with HIV, they fear that they will be misjudged and they won't have the money or the job needed to suffice for themselves. So most of them don't even come to these prevention programs as they feel that they're not confidential enough. The lower reliance of condoms is still relevant, as sexual contacts are still the major mode of transmission in Ghana. Supplies and finances, even though Ghana has received finances from one of their previous prevention methods, it is not the fact of finances, the fact of supplies getting to these rural areas, which could be shown more in the eastern regions and even some in central Ghana near Greater Accra. Overall, today in Ghana, the HIV and AIDS epidemic is at a low level, with its sexual transmission remaining the major mode of HIV transmission. Currently, there is an estimate of 350,000 adults and children living with HIV, and the numbers of deaths due to AIDS is now at 13,000, which contributes to adults and children. HIV new infections has reduced by 57%, and AIDS has reduced by 33% from 2000 to 2015, while also increasing its HIV testing in women and actually doubling it since 2008. So overall, there has been advances, and there still is room for development in terms of policies and programs, as well as funding to continue to support these populations with ART, promote more testing in clinics, and even having clinics in more rural areas and having more confidentiality and maybe more human rights for these women so they could feel better speaking up and supporting services. These are my references, and this concludes the end of my presentation. Thank you guys for stopping by, and I hope this was informative. You guys have a wonderful day. Bye.